Health experts are expressing concern over the Department of Health and Human Services recommendations of fewer vaccines for most American children.
Yeah, a number of the recommendations remain intact, including the MMR vaccines as well as polio, chickenpox, HPV, and a few others. However, officials this morning are narrowing recommendations for some vaccines, including hepatitis A and B to children who are at risk for higher risk for infections. Some experts worry reduced vaccinations could lead to more preventable infections in children.
Changes to our schedule are needed, and over the years we've made lots of changes when evidence supported it. They should come from careful scientific review. Parents deserve clear, consistent, evidence-based guidance they can trust.
As for the flu, COVID-19, and rotavirus, officials recommend vaccine decisions be based on consultation with your health care provider. As those changes go into effect, we're hearing more and more reactions from health experts across the country.
Some are celebrating the change, while others are raising concerns about how this may impact the U.S. in the long run. GMAT's Marshall Farmer joins us now after scouring social media for statements from health experts and lawmakers. Marshall, what are we hearing?
Yeah, Deanna and Trent, we're seeing both current and former members of federal health administrations having different opinions on the vaccine schedule changes, with some raising questions about how the changes came to be in the first place. In a press release, Health and Human Services Secretary RFK Jr. says that HHS and CDC looked at peer countries over the past month to see if the U.S. could improve their vaccine schedule. He says the new changes from that review, quote, protects children, respects families, and rebuilds trust in public health. However, Dr. Dimitri Daskalakis, a former director of the CDC's National Center for Immunization and Respiratory Diseases, says vaccine schedules should reflect disease patterns and access to healthcare in the U.S. He says that those factors were, quote, not adequately considered in the development of the new schedule. We're also hearing concerns from Senator Bill Cassidy of Louisiana. He's a physician and the chair of the Senate's Health Committee. In a post on X overnight, he says the changes will, quote, cause unnecessary fear for patients and doctors and make America sicker. Now, according to the HHS, all impacted vaccines are still fully covered by Affordable Care Act insurance plans and federal insurance programs. The newly updated vaccine schedule can be found on the HHS website if you want some more details. Deanna, Trent.